Today, we're tackling something that for millions of you is just so much more than a bad headache.
Hmm.
We are talking about chronic migraines. And look, if you suffer from them, you absolutely know they're utterly debilitating.
Yeah, completely life-altering for so many patients.
Exactly. It's not just, intense throbbing pain. It's that crippling sensitivity to light, to sound, the nausea that just won't quit.
Sometimes for days on end.
Right. It basically brings your entire life to this screeching, painful halt.
And that cycle, that chronic pain loop, it's something people are just desperate to break free from.
Totally.
And for way too many, the routine is just
Well, it's predictable, isn't it? The pain hits, you reach for the medication.
the symptom masking stuff.
Right, you get some temporary relief, maybe, and then boom, it's back. The pain inevitably returns.
So our mission today, our deep dive, is really to explore sources that talk about a different way. Something potentially powerful, natural, effective, and this is key, a long-term strategy. Exactly, long-term relief. We're focusing specifically on advanced chiropractic care, looking at the research and the specific protocols that are presented in the materials we analyzed.
Okay, and here's the part that honestly jumped out at me right away from the source material. It's kind of the core idea for today.
What's that?
The claim that the actual source, the root of that intense, debilitating migraine pain, it might not even be in your head.
Right.
It could be starting lower down in your neck, specifically the cervical spine.
Mm-hmm.
And that idea, well, it really challenges how most people probably think about their pain,
It does. But that spine-to-head connection, that's the absolute critical insight we need to unpack today.
Okay.
And we're drawing heavily from sources that detail the work of Dr. Korikoff. He's a doctor of chiropractic, a DC at Advantage Healthcare of Spartanburg.
Got it.
And his practice really emphasizes a gentle, patient-focused, and deeply holistic approach. The whole idea is to fix the mechanical issues in the neck.
Which he sees as the main trigger.
Exactly, the central trigger for that migraine activity.
Yeah.
So yeah, we're going to walk through the science behind this claim, explain why a DC, a chiropractor, is actually well-positioned to offer this kind of structural relief.
Okay, let's really dig into this anatomical link then. Because, for someone listening whose pain is mainly behind one eye, or maybe it hammers their temples, hearing that the neck is the main culprit, well, it sounds, frankly, a bit weird, counterintuitive. How do we connect those dots?
Yeah, I get that. But it actually makes perfect sense when you look at how the nervous system is laid out.
Mm-hmm.
The cervical spine, your neck. It's an incredibly complex structure
Mm-hmm.
and vital.
Okay.
It's made up of the 7 delicate vertebrae, C1 down to C7, plus this really intricate network of muscles, ligaments, nerves, all packed into this tiny, highly mobile space.
Very mobile, yeah.
And it's the main highway, really, for communication between your brain and the rest of your body. And the really crucial information, the signals related to headache generation, they pass right through that top area.
So it's like Grand Central Station for nerve signals related to the head.
Pretty much, yeah. A very busy hub.
Okay, so if that area is the hub, what's the specific mechanical problem? What goes wrong there that kicks off this whole migraine cascade?
The main issue, as it's defined in chiropractic science, is something called vertebral subluxation.
Okay, sounds serious. Subluxation.
It sounds dramatic, but let's be precise. It basically means a misalignment or even just a minor functional shift. The joint isn't moving quite right in one or more of those neck vertebrae, especially the upper ones, C1, C2, C3.
So it's not like a bone is totally dislocated or broken?
No, not usually that dramatic. It's often more subtle. It just means the joint isn't functioning, isn't moving exactly as it should. But even that subtle change is enough to create irritation.
But just a subtle irritation, how does that lead to, crushing, make you want to hide in a dark room pain? That seems like a big leap.
It does, but that's where this cascade of problems the sources talk about really comes into play. It's not just the misalignment itself.
Okay, what happens next then?
Well, that subtle subluxation, that joint dysfunction, it immediately creates mechanical irritation on the nerves right next to it, the ones exiting the spinal column there.
Right.
And when nerves get physically irritated, what happens? They get inflamed.
Okay, inflammation. Makes sense.
So you get this local inflammation, and then the body, trying to protect that irritated area, tenses up the surrounding muscles, like it's guarding it.
So the muscles in the neck and shoulders tighten up?
Exactly. They become chronically tight. So now you've got this lovely little mix. Nerve irritation, local inflammation, and muscle tightness, all happening right there in the upper neck.
Okay, a trifecta of local misery in the neck. But I'm still trying to bridge the gap. how does that local problem translate into pain felt, behind my eye or in my forehead?
Right. This is the key connection. This is a really crucial part for anyone suffering from migraines to grasp. The irritation of those nerves coming out from the upper neck, again, C1, C2, C3, primarily feeds directly into a critical structure deep in your brainstem. It's called the trigeminal cervical nucleus.
Whoa, okay. Trigeminal cervical nucleus. That sounds like some serious neurological real estate.
It absolutely is, but think
Yeah.
of it like a central processing station or a convergence point for pain signals.
Okay.
A processing station.
Yeah. Now, the trigeminal nerve, that's the big one that handles almost all sensation from your face and the front of your head. And guess what? It also feeds into this exact same nucleus.
So signals from the face, A&D signals from the upper neck are both landing in the same spot.
Precisely. So if you have chronic irritation and inflammation coming from that neck subluxation, it's constantly bombarding that nucleus with distress signals nonstop.
Yeah.
That processing station gets overloaded. It becomes hypersensitive. And here's the kicker. The brain, or at least this part of the brainstem, it can't easily tell where the distress signal originated. Is it coming from the face, the trigeminal input, or is it coming from the neck, the cervical input?
So it just gets this massive jumble of pain signals. Exactly. It interprets the overall signal overload, this constant static, as centralized head pain, what you feel is a migraine. The actual source of the signal disruption is that mechanical and neurological interference down in the neck.
But the sensation, the pain you feel, is up in your head.
That's the connection. That's the theory these sources are really driving home.
Yeah.
The body's sending out this huge, garbled distress signal because the communication lines are jammed or compromised at that central relay station.
So it's way more than just a muscle knot. It's like a systemic communication breakdown starting right there in the neck.
That's a great way to put it, a communication failure.
Yeah.
And so the next logical question is, what causes these misalignments, these subluxations in the first place?
Right. Why does the neck get out of whack?
The sources give a pretty comprehensive view here. They basically group the causes into three main types of stress.
Okay. Let's start with the one most people probably think of when they hear chiropractor. Physical stress. This would be things like, whiplash from a car accident, maybe a bad fall, a sports injury. Acute stuff.
Definitely. Those big high-impact traumas are absolutely prime candidates for causing a sudden subluxation, no question.
But the sources say it's often something else, right? Something more insidious.
Exactly. What's far more common, and maybe even more damaging over time, is the simple physical stress of modern life, specifically poor posture, especially working at a desk.
Ah, the dreaded desk slouch.
Yes, that repetitive day-in, day-out slump, often what we call forward head posture, where your head drifts forward even just a few inches off your shoulders.
Right. I can picture that.
Well, get this. For every single inch your head moves forward from that neutral alignment, the strain on your neck and upper back muscles increases dramatically.
How much?
It could add 10 pounds or even more of effective weight that those muscles have to constantly support.
Wow. 10 pounds per inch. That's huge.
It is. So imagine subjecting your spine to that kind of sustained, incorrect load. 6-8 hours a day, 5 days a week. That's not a sudden trauma. That's chronic erosion. It slowly grinds down proper alignment.
That makes total sense. It's a slow motion injury almost.
Precisely. And we need to think about ergonomics here, too. It's all connected. Is your monitor too low? You're craning your neck down all day? Is your chair forcing you into a slouch? Then your upper back rounds and your head juts forward to compensate. This constant non-neutral positioning. It creates that slow, chronic subluxation and keeps those nerves irritated. It's really the silent stressor of our digital age.
Okay, so physical stress, both acute and chronic, especially posture. What's the second major stressor?
Emotional stress.
Right. We all talk about feeling stressed out or run down, but how does feeling anxious or overwhelmed actually translate into a physical misalignment in the neck bones?
It's purely physiological. It's your body's hardwiring. When you experience high emotional stress, your sympathetic nervous system kicks into high gear. That's your fight or flight response.
Okay.
And what does that system do automatically? It triggers protective muscular bracing. It tenses you up, preparing for danger.
And where do we feel that tension the most?
Shoulders and neck, right? The trapezius muscles, those big ones on top of your shoulders, and the lubator scapulae running up the side and back of the neck.
Yeah, the ones that practically try to meet your ears when you're really stressed.
Exactly.
Those are.
So, under chronic emotional stress, those muscles become chronically tight, hypertonic, restricted. They never fully relax.
Okay.
And this sustained tension acts like a continuous physical force. It's constantly pulling, slowly but surely, on those delicate cervical vertebrae, pulling them out of their optimal alignment.
Ah, so the stress causes the muscle tension?
The tension causes the misalignment, the subluxation,
And the misalignment irritates the nerves.
which then feeds back into the pain cycle,
Yeah.
potentially triggering a migraine and probably causing more stress.
Wow, it's a vicious feedback loop.
Totally self-perpetuating. And it really highlights why you often need a physical intervention to break that cycle, even if the initial trigger was emotional.
Makes sense. Okay, so physical, emotional. What's the third factor?
The third one is repetitive strain. This is really common in certain jobs, or even hobbies, where you have to maintain an awkward or non-neutral neck position for long periods.
Can you give some examples?
Sure. Think about, say, a hairdresser. They're often holding their arms up, tilting their head to one side while they cut in style, hour after hour.
Yeah, okay.
Or maybe a musician. Violinists, for instance, hold their instrument in a very specific, sustained, asymmetrical posture.
Right.
Or think about dentists, surgeons,
Mm-hmm.
people who spend hours leaning over a patient. Any activity that forces your neck into a sustained, non-neutral position. Over time, that leads to gradual misalignment and that chronic nerve irritation we keep talking about.
So it could be your job, your hobby, things you do every day.
Absolutely. And what's really crucial here, according to the sources outlining Dr. Korokov's approach, is that he acknowledges all three of these stressors: physical, emotional, and repetitive strain.
It's not just one thing.
Right. You need that holistic view, looking at the whole picture of what might be contributing to the root cause if you really want a long-term solution.
Okay, understanding those different causes, physical, emotional, repetitive, that's super important. Now let's shift gears and talk about the solution side. The sources we looked at really try hard to reframe what advanced chiropractic care actually involves. They're very clear. It's not about random, forceful adjustments, not the stereotype of just, cracking your back.
Yeah, that's a really key distinction they make. The source material defines this kind of treatment as a very precise scientific method. The whole focus is on restoring optimal function.
Function of the spine.
Right, and therefore function of the nervous system that runs through it. The goal is structural integrity, making sure everything's moving correctly, and allowing that neuromusculoskeletal communication to happen without interference.
And the techniques themselves.
Often quite gentle and very controlled. Dr. Korokov, for example, is noted for using specific force vectors, specific directions and amounts of pressure, rather than just generalized leverage or force. It's targeted.
Okay. And when we look at the evidence for this approach, specifically for migraine sufferers, the claims are pretty compelling.
They are.
The sources point out that research has consistently shown that these kinds of targeted chiropractic adjustments can significantly reduce the frequency, the intensity, and the duration of migraine attacks.
Which covers basically everything a patient cares about. Right.
Exactly. It's not just, can you make this headache go away now? It's, can I have fewer of them? And can they be less severe when they do happen?
And right here, I want to pause and bring in a really critical point the sources emphasize. It's a comparative claim.
Okay.
They note that some independent studies have actually found this type of specific spinal manipulation to be as effective as certain common preventative medications for migraines.
Wait, hold on. You're saying physically adjusting the neck could potentially give someone the same level of relief as taking a daily preventative drug?
That's what some of the research suggests, according to these sources. It's a bold claim, I know.
It is bold. How do they account for different types of migraines? Like, what about an ocular migraine with visual disturbances? That feels less connected to the neck, maybe.
That's a fair question, and it comes back to the assessment. If a migraine's pathology is determined to be purely vascular, for example, then maybe chiropractic isn't the primary answer.
Okay.
However, the argument in these sources is that even in complex cases, there's almost always a structural or cervicogenic component contributing. The research making that comparison, yes, it focuses primarily on tension-type headaches and definite cervicogenic headaches.
The headache's clearly originating from the neck.
Right. But the principle holds. If nerve interference is a trigger, or even just a contributing factor, then the adjustment provides a measurable physiological benefit by removing that interference.
And the reason a patient might strongly consider this, even with that bold claim,
is the massive asterisk next to the medication's side effects.
Ah, right. The potential downsides of long-term drug use. Things like, fatigue, maybe digestive problems, sometimes that brain fog feeling.
Exactly. Those can be significant drawbacks for people needing long-term prevention. So the potential benefit of getting the same or maybe even better reduction in frequency, intensity, and duration, but without those systemic side effects.
That's the core advantage they're highlighting.
Precisely. It's about addressing the root cause, that mechanical neurological interference, instead of just chemically managing the symptoms downstream.
Makes sense.
And Dr. Korokov's practice, as described, ensures the treatment is really comprehensive by using what we can basically call the 3 pillars of treatment.
Okay, let's break those down. Pillar 1 is the cornerstone, right? Chiropractic adjustments or spinal manipulation.
Yes.
We've established it's meant to be gentle, scientific. How does Dr. Korokov's application maybe differ from that general perception people might have?
The big emphasis is on precision. He's not described as doing generalized manipulation across the whole neck.
Okay.
The adjustments involve using very specific, controlled, gentle force, often using specialized instruments or maybe low-force manual techniques to correct the exact vertebral subluxations that were identified in the initial exam.
So it's very targeted.
Extremely targeted. And that's important because, a generalized adjustment in the neck, if not done carefully, could potentially stir things up. But this targeted correction, the goal is immediate relief of pressure on those irritated nerves.
And the immediate result of that specific adjustment is?
You restore proper joint motion right at that segment. You remove the neurological interference. You clear the static on that communication highway we talked about.
Right.
When that mechanical pressure comes off the nerve, the inflammatory process gets interrupted and the pain signal generation starts to decrease, sometimes right away. It's a direct physical fix for the mechanical problem.
Okay, that's pillar 1, the adjustment. Pillar 2 seems to recognize that migraines aren't just about bones and nerves. There's that intense muscle reaction, too.
Oh, absolutely essential.
Which you said is both a cause and a symptom. This is soft tissue therapy.
Yes. You absolutely have to address the muscles. Think about it. If you only adjust the spine, but you leave those super tense muscles constantly pulling the vertebrae right back out of alignment.
The relief won't last.
Exactly. It'll be temporary at best. So the soft tissue work is the necessary partner to the adjustment. This is where the focus is on breaking up those chronic tension patterns that we talked about earlier, the ones caused by stress or posture.
What kind of specific techniques fall under soft tissue therapy? The source mentioned things like myofascial release.
Myofascial release is a big one here. So fascia, think of it like a thin, tough sheath or a web that surrounds and runs through every muscle. When muscles are chronically tense, maybe from that emotional stress or bad posture, that fascial sheath gets tight, restricted, kind of glued down. It creates these muscular adhesions or knots that physically limit blood flow and, importantly, pull on the bones.
Right.
Myofascial release involves applying slow, sustained pressure to those specific tight areas to kind of unstick the fascia, release the tightness, and restore its normal elasticity and glide.
Okay. And that's paired with trigger point therapy.
Yes. Trigger points, those are the infamous knots you can feel. They're highly localized, hyper-irritable spots within a taut band of muscle. They can be exquisitely tender and often refer pain elsewhere.
Yeah, everyone knows those knots.
Right. So trigger point therapy involves applying specific targeted pressure directly onto these points. The idea is to release the chronic contraction within that knot, which relieves the muscle's overall tension and reduces its pull on the cervical spine.
And this is focused on specific neck and shoulder muscles.
Definitely. They target the muscle groups most commonly implicated in cervicogenic pain, like the small muscles at the base of the skull, the suboccipitals, the SCM muscle on the front side of the neck, and the upper trapezius, those shoulder muscles again. It's very specific work.
Okay, adjustments and soft tissue work. That brings us to the third pillar, which sounds like it elevates the chiropractor beyond just fixing the immediate problem. It's about partnership, customized lifestyle, and nutritional advice.
This is huge. This is where the long-term strategy really comes into play. Sustainable relief lives here.
How so?
Well, the adjustments fix the immediate mechanical issue, right? The soft tissue work helps release the muscle patterns. But it's your daily lifestyle habits that often determine whether the problem just comes right back.
Makes sense.
So Dr. Korokos, according to the sources, provides professional guidance on several really critical areas. First up, postural correction and ergonomic setups.
We talked about how bad posture is a major trigger. What kind of specific advice are we talking about here? Is it just sit up straight?
No, it's much more detailed than that. If a patient sits at a desk all day, the chiropractor helps them actually design a workspace that's biomechanically neutral for their body.
Okay.
That means making sure the monitor is at eye level so you're not looking down or up, Make sure the keyboard is positioned so your elbows are roughly at 90 degrees, ensuring the chair provides good lumbar support.
These aren't just minor comfort things then.
Not at all.
Yeah.
They are the difference between constantly straining your neck versus allowing it to heal and stay in alignment. It also includes teaching targeted exercises.
Exercises for the neck.
Yeah, specifically to strengthen the deep neck flexor muscles and other stabilizers. These often get really weak from years of that forward head posture, so you need to actively strengthen them to provide better support for your head and neck.
Okay. And then, crucially, nutritional advice. A lot of listeners probably know certain foods can be migraine triggers, but figuring out which ones, that can be tough.
It can be really tricky. The guidance here is described as clinical and focused. It's about helping the patient minimize known inflammatory dietary factors and identify their personal triggers.
What are some common culprits?
Well, things often mentioned include aged cheeses, cured meats that contain nitrates and nitrites in deli meats, hot dogs, certain sulfites, which are often found in red wine,
Okay.
and sometimes even caffeine withdrawal can be a trigger for some people. The chiropractor guides the patient through maybe an elimination diet process to pinpoint their specific sensitivities.
And it's not just about avoiding bad stuff.
No, it's also about ensuring they're getting enough of the good stuff, making sure they have optimal levels of certain nutrients that are often linked to migraine management. Things like B vitamins and magnesium are frequently mentioned.
So it's a really comprehensive plan. Fix the alignment with adjustments, release the muscle tension with soft tissue work, and then prevent it from coming back with posture, ergonomics, exercise, and nutrition.
Exactly. Tackling it from all angles. That's the idea behind these 3 pillars.
All right, so now let's drill down a bit more into the specifics of the care outlined in our sources, focusing on Dr. Korikoff. He's really highlighted as providing, well, superior care because he combines deep medical expertise with these advanced chiropractic techniques.
Yeah, that combination is presented as a pretty significant differentiator. It suggests he has a broader capability when it comes to differential diagnosis,
Meaning?
meaning he can assess symptoms and more clearly rule out other conditions that might look like a migraine or a cervigenic headache, but actually aren't primarily mechanical.
Okay, that makes sense, having a wider lens.
Exactly. And the patient story referenced in the sources, Robert Erickson's story, it's a perfect example of this.
How so?
Well, Erickson had apparently spent years seeing various neurospecialists. They focused entirely on prescribing different drugs, trying to manage the pain that way.
But missing the underlying cause.
Completely missing the structural cause, according to the story. Dr. Korikoff's combined understanding, knowing both the medical side and the detailed chiropractic structural side, allowed him to recognize that this persistent facial and head pain was actually coming from mechanical interference originating way up high in the neck at the C2 vertebra.
And the outcome was good.
Exceptional outcomes were noted, yeah. It really highlights the value, for that patient at least, of integrating knowledge from both traditional medicine and advanced chiropractic.
Okay. Let's get into the details of his specific headache migraine treatment protocol. It's laid out as a 5-step process, which sounds very structured, very rigorous.
It does, very systematic.
Step 1 is a comprehensive neurological assessment. What does that involve?
This is the foundation. It's way more than just asking about your symptoms. It involves detailed testing, checking reflexes, testing sensory function in different skin areas or dermatomes, assessing muscle strength, checking range of motion. The goal is to precisely map out where the neurological interference seems to be happening. You really have to understand the specific nerve involvement before you start any treatment.
Right. Pinpoint the problem area first. Then step 2 is the core intervention. Precise cervical adjustments.
Correct. And as we said, these are targeted specifically at the subluxations identified in step 1, not generalized.
Okay. Then step 3 is trigger point therapy.
Which, as we now understand, is vital for dealing with that severe, often painful muscle tension component, the part that also feeds pain signals into that trigeminal cervical nucleus we discussed.
Right, breaking that muscle tension cycle. And then steps 4 and 5 seem focused on making the relief last. Step 4 is lifestyle modification guidance,
which covers the posture, ergonomics, exercise, nutrition we talked about, tailoring it to the individual.
And step 5 is long-term prevention strategies. What does that usually entail?
This is about making sure the treatment isn't just reactive, but truly rehabilitative and preventative. So long-term strategies often include guidance on maintenance care.
Like checkups.
Yeah, maybe periodic checkups just to make sure small issues, small subluxations aren't creeping back in and developing into major problems again. It also involves equipping the patient with self-management tools,
Like what?
maybe specific stretches they can do at home or work, awareness cues to check their posture throughout the day, things they can actively do themselves to maintain that improved state long term.
Okay, so it's a very layered approach.
Mm.
Assess, adjust, release tension, modify lifestyle, prevent recurrence.
Exactly, sequential and layered.
Now, going even deeper into the specialized science side, the practice is also noted for offering advanced solutions for nerve pain, focusing specifically on identifying and treating nerve compression.
Hmm.
What kind of, state-of-the-art diagnostic tools are we talking about here? How do you pinpoint something as subtle as nerve compression?
Well, it often starts with advanced imaging interpretation. This means they're not just glancing at X-rays or MRIs, they're thoroughly analyzing them,
Looking for what?
looking beyond just the obvious stuff like fractures. They're searching for subtle soft tissue changes, maybe early degenerative patterns, or those small disc bulges that might just be pressing on a nerve root. When you're dealing with complex persistent nerve pain, you need that level of detailed visual analysis.
Okay, and once they identify a potential compression point, the treatment goes beyond just the standard adjustments.
Yes. The interventions will likely include those targeted spinal adjustments, absolutely, but they also bring in specific rehabilitative techniques. One mentioned is neural mobilization techniques.
Neural mobilization sounds like physiotherapy for the nerves.
That's a pretty good way to think about it. Sometimes it's called nerve gliding or nerve flossing.
Nerve flossing. Okay, explain that.
Sounds a bit strange, but the concept is fairly simple, even if the execution requires skill. So if a nerve gets compressed or maybe stuck by scar tissue or tight fascia around it, it loses its natural ability to slide and glide smoothly within the surrounding tissues as you move your body. Nerves need to move.
I never thought about nerves needing to slide.
They do. And if they can't, that creates constant irritation and tension on the nerve itself every time you move that body part. So neural mobilization uses specific, gentle, controlled movements.
Movements of the limb or neck.
Yes, designed to gently ease the nerve along its path, encouraging it to slide more freely again. It helps restore its natural mobility and reduces that mechanical pressure and tension directly on the nerve.
Wow. Okay, that's quite specific.
It is, and they combine this with custom exercise programs and progressive rehabilitation protocols.
To make sure the whole structure gets stronger and more stable.
Exactly. It ensures that the physical structure supporting that nerve is stable and functioning correctly long after the initial treatment phase is over. You're building stability. The goal isn't just to free up the nerve temporarily.
It's to prevent it from getting compressed again.
Precisely. You want to strengthen the musculature around it, so the subluxation, or the condition causing the compression, doesn't just immediately recur when the patient goes back to their normal life.
Okay. This really paints a picture of a very holistic scope of care. It seems like the same mechanical principles they use for migraines apply right across the musculoskeletal system.
That's the idea.
The practice seems to have a really deep bench of expertise, well beyond just headaches. What stood out to you from the broader list of injury treatments they handle?
Well, the list is pretty comprehensive, yeah. It really emphasizes that if the problem involves pain, mechanical dysfunction, and potential nerve interference, they likely have an approach for it.
Like what specifically?
They specifically mention specializing in whiplash injuries, often from car accidents.
And whiplash often leads to really stubborn headaches, right?
Absolutely. Those cervicogenic headaches after whiplash can be notoriously difficult because of the ligament and the soft tissue damage involved. They also mention sports-related trauma and general work-related injuries.
All common ways people mess up their alignment.
Exactly. They're all common sources of that mechanical stress and the resulting nerve interference that benefit from that specific, often gentle, functional restoration approach we've been discussing.
Plus, just general acute and chronic neck pain and even complex spinal conditions are listed.
Right. And that extends further into managing chronic conditions too.
Such as?
Things like osteoarthritis, degenerative disc disease, general chronic pain conditions, also joint dysfunction, and other musculoskeletal disorders.
So even for things that sound degenerative, like arthritis.
The unifying theme, as presented, is always about restoring proper joint mechanics as much as possible and relieving any associated pressure on the nervous system. Even with arthritis, optimizing joint function can often reduce pain and improve quality of life. If the pain has a structural component, this expertise is relevant.
Okay. Let's circle back finally to posture correction. We established early on how fundamental that is for long-term migraine prevention. They detail a specific, rigorous, scientific approach to posture correction.
Yes, and this sounds like it goes way beyond just telling someone to sit up straight.
How so?
It involves using precision technology alongside the rehabilitation. The process includes things like digital posture assessment.
Using computers or cameras to analyze posture.
Presumably, yeah.
Yeah.
Along with a thorough spinal alignment evaluation. They're using objective, measurable data
That's
to
tender.
quantify exactly where and how the patient is misaligned, not just eyeballing it.
That quantitative data must be really helpful for planning treatment.
Absolutely. Based on that objective data, the patient gets a personalized, custom correction plan. This isn't just exercises. It includes specific stretches, maybe strengthening work, and that detailed ergonomic counseling we talked about advice for their specific desk setup or work environment.
And they track progress.
Yes. Ongoing progress tracking is mentioned, so it's an iterative process. They monitor how the patient's posture and alignment are actually changing over time using objective measures.
So you can actually see the improvement, not just feel it.
Exactly. It helps ensure the overall treatment plan, the adjustments, the soft tissue work, the exercises working effectively, and can be fine-tuned as needed. It turns that subjective feeling of, I think I'm doing better, into a verifiable, evidence-based improvement in your structural health.
Okay, we've covered the science, the approach, the specific protocols. Now let's hit some really practical points. Things listeners considering this path absolutely need to know. First off, the big one, safety.
Always a concern, especially with the neck.
Right. Does the source material address the safety of chiropractic care for migraines directly?
It does. The assurance given is pretty firm. When this care is performed by a licensed doctor of chiropractic, a DC, someone who's gone through extensive, rigorous training,
Okay.
it is widely recognized as a safe and non-invasive treatment option for both general migraines and those clearly cervicogenic headaches.
And the specific techniques mentioned, the gentle targeted ones.
Those low-force specific techniques are noted as being particularly safe, especially for the sensitive neck region. And for many people, this approach represents a potentially less risky alternative compared to the possible long-term side effects of using certain medications chronically.
Okay, that's reassuring. Next practical question. Duration of care. This is always the million-dollar question, isn't it? How long will this take? How many sessions until I feel better?
Yeah, everyone wants to know that. The sources are realistic here. They acknowledge that results definitely vary.
Yeah.
Not every chronic migraine case looks the same.
Makes sense.
So they offer a range of expectations. For someone whose problem is more recent, maybe an acute injury or misalignment, they might experience significant relief pretty quickly, maybe after just 1 or 2 adjustments.
But for the chronic sufferers,
For those with chronic long-term issues, maybe someone whose subluxations have been slowly developing for years due to that bad posture or repetitive strain we discussed,
yeah,
they're likely going to need a more extensive, personalized treatment plan. It takes time.
because the body has adapted to being wrong, essentially. The soft tissues, the ligaments, they've learned the bad habits.
Exactly. If those structures have adapted to a state of chronic misalignment, it simply takes longer to gently retrain them to restore proper function and stability. The key word is personalized.
So Dr. Korokov creates a plan based on the individual.
Right. Based on their specific condition, their health history, how severe the neurological signs are, what their lifestyle stressors look like, all of that gets factored in. It's really framed as an investment in rehabilitation, not just a quick Band-Aid fix.
Okay. Good to set realistic expectations. Now let's talk logistics. Money and location. First, cost. Is chiropractic care for migraines typically covered by insurance?
That's a huge factor for most people. The good news, according to the sources, is that many insurance plans do offer coverage for chiropractic care, recognizing it as necessary musculoskeletal treatment.
Okay.
The team at Advantage Healthcare of Spartanburg, specifically, is noted for helping patients figure out their benefits and understand what their specific plan covers.
So, always best to check your own policy, but coverage is common.
Definitely check, yes. But this root cause approach is often covered as essential care, which is great.
And for listeners who might be in the upstate South Carolina area hearing about this specific expertise, what's the geographic scope? Where is Dr. Korokov located?
He's based in Spartanburg, South Carolina, and the practice serves that city and the surrounding communities in the upstate. They specifically list Boiling Springs, Duncan, Greer, Lyman, and more as areas they serve.
Good to know for locals.
Yeah, it shows that commitment to serving the regional community with this kind of specialized care. But the overarching message, beyond the logistics, it really comes back to a kind of philosophical point about patient choice, doesn't it?
How do you mean?
Well, it's about shifting your mindset, really. Instead of just waiting for the symptom, the migraine attack to hit, and then reacting by taking medication to try and mask the pain, you're making a proactive choice. You're choosing to work on the underlying mechanics. You're actively addressing the potential root cause, that nerve interference, that subluxation in your neck, ideally before the symptom even gets a chance to fully blow up.
So it's preventative in a very physical sense.
Absolutely. You're investing in your long-term structural health, your neurological health. The goal is sustained freedom from pain, not just temporary chemical suppression of the symptoms. It's really about empowerment, isn't it?
Yeah.
Taking some control back over the physical factors that might be contributing to chronic suffering. Hashtag tag out tag outro.
Okay, so let's try and synthesize this whole journey we've taken. We started with the really devastating reality of chronic migraines for so many people. Then we moved to that, frankly, surprising biological connection, the idea that the neck's complex structure, specifically misalignment or subluxation there, can be a central trigger by causing neurological overload.
Right, that trigeminal cervical nucleus connection.
Exactly. And finally, we detailed the scientific three-pronged solution presented by practices like Dr. Korokov's. Those precise adjustments, the targeted soft tissue therapy, and that absolutely essential lifestyle modification piece.
And the real power of that approach, as described, seems to lie in how comprehensive it is. It's not denying the neurological reality of the pain, but it's offering a tangible physical intervention to interrupt the cascade that leads to it.
But as we wrap up and leave you with a final thought to chew on, let's circle back to that crucial third pillar, the lifestyle component.
Yeah, the part you control every day.
Right. The sources really hammered home the role of posture, ergonomics, even nutrition in managing migraines. It implies that even tiny, seemingly unrelated daily physical habits can silently contribute to that nerve irritation and inflammation over time.
We talked about how emotional stress physically tightens muscles, leading to misalignment. It all connects.
So if your daily routine, the way you hunch over your phone, the way you might slouch while driving, maybe the foods you consistently eat, if that's constantly creating friction and interference on that nervous system highway.
Then lasting relief really has to involve a daily commitment to changing those behaviors, doesn't it?
It seems so. So here's the question we want to leave you with. If chronic, seemingly harmless habits like just having slightly poor posture day after day can slowly, over time, build up enough nerve compression to trigger a severe migraine. What is one simple ergonomic adjustment or one small postural habit you could change today? Maybe it's just setting a timer on your phone to remind you to sit up straight every hour. Maybe it's putting a book under your monitor to raise it just 2 inches.
Something small but consistent.
Exactly. What's one simple step you could take right now to try and restore clear communication along your body's nervous system highway? Because that small step, that effort to correct daily strain, it might just be the most powerful long-term prevention strategy you can possibly adopt. It could potentially be part of turning off the switch to your chronic pain.
That's a really compelling thought to end on. Food for thought, definitely. Thank you for joining us on the Deep Talk today. We sincerely hope this exploration has maybe opened up a clearer, more proactive path toward lasting relief for some of you.